Here with us today from Patient First, once again, Dr. Mark Hippensteel, and we're talking about kidney stones.
Yes, good morning, Carrie. How you doing? Basically, kidney stones are pretty miserable. They're caused from a variety of different reasons, all depending on basically what type of stone you're having. They're basically made up of calcium oxalate, uric acid crystals, struvite, and all these components of the kidney stones basically form for different reasons, whether it be that the patient is excreting too much of those components into the urine. Also, if they have recurring infections, they can cause stones. An underlying cause also is chronic dehydration. Patients who don't drink a lot of fluid will tend to concentrate those substances, and they will form into small stones and grow over time.
Is there anything, any kind of like family history or a genetic link that could predispose somebody to kidney stones?
Unfortunately, yes. If you have a family member, your mom or dad had stones, or relative, chances are you're going to have them. Other risk factors are being a guy, older than 40, being overweight. Those are all risk factors. And also if you've had gastric bypass surgery.
Really?
Or chronic inflammatory bowel disease problems. Those are things that will interfere with the normal handling of metabolites and calcium and cause higher rates of deposition in the kidneys.
The symptoms come on kind of suddenly and can be pretty alarming, right?
Yeah, they're pretty miserable. You can see a kidney stone patient a mile away. When they're passing a stone, it's just absolutely miserable. Flank pain, radiating around to the front and the abdomen, just exquisite tenderness, pain, usually associated with, well, one of my fans.
Is that you?
Yes. Must be a kidney stone patient. Excuse me.
That's okay. I actually had a deployment to Haiti during my Navy career and was with someone who had a kidney stone, and I mean, it was the worst pain I've ever seen anybody in. Where do you keep that thing?
I don't know. Okay, there we go.
But anyway, I mean, it was bad. I mean, the pain made him vomit, and I mean...
Yeah, it basically is intense. They can't get comfortable in any degree, and basically they can have blood in the urine and just miserable pain. They can take from anywhere from an hour to 2 days to pass.
Oh my gosh. So it just, I mean, obviously it has to come out, and you can figure out where it needs to come out. But if somebody starts to have some pain, is there anything that can be done to make them smaller, break them up? Do they always have to come out? Or
usually. Well, it depends on the size. I'm going to leave that home next time. It depends on the size of the stone. Ideally, if the patient can be hydrated and given pain medications, they'll be able to pass them on their own.
Yeah.
Other patients, if it's not passing, they may need to get lithotripsy done to break up the stone, help them pass that. And if that's not successful, then they have to undergo surgery and remove it. Other types of treatment will be basically going up with a little scope and grabbing that stone and removing it that way. But
none of that sounds like any fun.
It's not a very happy patient either way.
All right. So you said in terms of prevention, hydration, what else can be done to avoid them?
Dietary changes. Depending on the type of stone, patients will be able to change their diet. Certain foods, spinach, beets, sweet potatoes, those are all things that can predispose you toward stones. If it's a calcium...
Oh, no, but they're good for you.
Yeah, but, well, there's other healthy things. Just get a multivitamin or something. Change your diet. If you have a kidney stone, you'll want to stay away from those foods.
Okay.
And also other medications, certain diuretics, allopurinol, those are medicines that can be given to patients to help prevent recurrences. So,
do they always come out, or can you have a stone that just stays where it formed?
A lot of times you can have what's called a staghorn kidney stone, which basically will hang out there in the kidney and give off little flecks of stones here and there. And usually when a patient knows they have one of those, it's like a time bomb. They'll say, look, please, I need to get rid of this, and they'll go to any extent to get rid of that stone, because they don't want to have another kidney stone being passed.
Before it decides to just kind of up and move on its own one day.
Deal with it before it happens.
All right. Thanks very much, Dr. Hippensteel. And should you find yourself suffering at all, you need to rush to a Patient First. They're open 365 days a year. There are 8 locations here in Hampton Roads. And again, they're open every single day of the year from 8 in the morning until 10 o'clock at night.
Absolutely. We're there for you.